The vision of Drugfield is to continue to be in this business of producing pharmaceutical products that will take care of people's health. And we know that it is not a business for a term. It's a business that's, for as long as human beings dwell on this planet, there will always be a need, for wellness.
The legacy of excellence, Drugfield Pharmaceuticals, and pharmacist Olakunle Ekundayo. In 1991, Drugfield Pharmaceuticals Limited was born out of a commitment to fill a void in the pharmaceutical landscape. This is the story of Drugfield Pharmaceuticals and the visionary behind its success, pharmacist Olakunle Ekundayo.
My name is Olakunle Ekundayo. I'm a pharmacist. I was born close to 70 years ago at Akure. Akure City is the capital of Ondo State in Nigeria. And I attended St. David's Anglican Primary School in Akure. And I also attended St. Thomas Aquinas College in Akure. And after my secondary school education, I came to Lagos. I did 2 years at the Yaba College of Technology, studying science, laboratory technology, at that time. That was between 1973 and 1975. And later went to Ife to study pharmacy.
I've known Mr. Ekundayo for quite a long time. We were in Ife together. He was able to maintain his own focus on what he could do concerning the dreams that we all had. We all had dreams during that time.
Perhaps it may be of interest to tell a little bit, about what I had in mind to study as a young boy. I had always wanted to be a medical doctor. And this was, what I thought I was going to do, who I thought I was going to be. But by providence, my experience at Yaba College of Technology helped in my final prelim exam, to the extent that I won a national scholarship. So throughout my pharmacy, studies at Ife, I was on a national scholarship. So it was a huge relief for my mother because she went through a lot, trying to train me from primary to secondary. She really, because she was a widow who had to train 7 children. And I was his first son. So she was determined that I wasn't going to be a mechanic like some people suggested at the time. The issue of being a mechanic, mechanics deal with automation, right? And it appeared to me now that may actually be prophetic, even though it didn't quite address what the end will be, like we have today. My father, when he was alive, was the first person to bring to Akure and perhaps Ondo State at that time, Ondo Province, automation, how to, use a machine to grind pepper, to grind corn, to grind beans, to grind anything. And he became very well known all over town as Baba Elero, So That's why the issue of automation, when somebody said, let him go and learn a mechanic. My mother said, no, this one has to go to school. And I ended up in a pharmacy school. Now, there's something interesting that developed in me when I was in a pharmacy school. I used to have an uncle who was a pharmacist. He's late now. And he was a production manager for Welcome. Welcome at that time was very big in Nigeria as a multinational drug manufacturing company. So I used to visit him when I was on holiday, and I loved, the dignity, attached to, his office and the way he carried himself and the way he was respected, in the factory. And I said to myself, when I finish pharmacy, I would like to also work in manufacturing, So I knew what I was going to do, and incidentally, that's what happened. As soon as I finished the first degree, I said to myself, let me do a master's in pharmaceutics, the same university. And at that time, there was an opportunity to do internship and the postgraduate at the same time. The window was open, and I got into it. I took advantage of it. So by 1981, I was done. And my uncle actually got me my first job at Glaxo Nigeria Limited, now GSK, in 1981. So I started as a production pharmacist. And after about 6 months, close to 6 months, I saw another window at Pfizer. And I said, oh, maybe, Pfizer may be a better environment. So I took the opportunity, and I was right. So that's how I got into Pfizer in 1982. And it was quite what I would call an interesting career, at Pfizer, because by 1986 I had become production manager. And Pfizer at that time was one of the big, if not the biggest, manufacturing company, pharmaceutical manufacturing company in Nigeria. In terms of dosage forms, that were being manufactured, Pfizer was doing practically all the dosage forms.
Pharmacist Kule Ekundayo, as I know him from the Pfizer days, joined us in February 1982. He was a production pharmacist in Glaxo and crossed over to Pfizer. And he is an unassuming person, very humble and very productive, very honest and highly dedicated. A rare person for his own generation, and indeed for multiple generations of Nigeria. He has a combination of quality, and yet is humble with it. He is exceptional in terms of knowledge of manufacturing, and that is demonstrated in terms of how he has become a great asset, not just to Pfizer, but to every other organization that he has had cause to manage, until eventually he decided to set up Drugfield.
Established as a multi-dosage company in 1991 and started production in 1993, Drugfield aimed to address the gap left by multinational companies. It was founded on a family legacy of industry and automation, with a mission to meet the expanding healthcare needs of the people.
But what I think primarily was his motivation was actually not money. His motivation was not money initially. It was more of a challenge. I can do it.
So my initial interest of trying to set up a community pharmacy practice, because that's where the name Drugfield, that's when I call it consummated the name. I didn't see it anywhere, but field, drug, field, So I came with the name, Drugfield Pharmaceuticals. Now, I was still very passionate about manufacturing. So after spending those years at Pfizer, I saw another opportunity just came. I wasn't looking for it. It just came, I want to believe by God's direction, that I had to leave Pfizer to go and help a Nigerian set up, a clean room facility to produce injectables. Pfizer was the only company in Nigeria at the time. So I had the experience, I had the know-how. So that was the, driving force that took me out of Pfizer. And I still remember my boss, he's late now. The day I told him I was leaving, he said, "Are you out of your mind? You want to leave Pfizer? Look at your career, brilliant, beautiful, to go and work for a Nigerian company?" But I left. And looking back now, I think it was part of the plan of God.
Drugfield's vision to make available medicines for the well-being of mankind. Our mission to improve the quality of life through the production, distribution, and sale of quality, safe, and effective medicines. Our commitment is anchored in a quality policy, ensuring products are excellent products from a sure source.
There were destiny helpers along the way. Now, the first major help I received was actually from the regulator. There was a very wonderful human being who was the deputy director in charge of inspectorate at the time. And I shared what I wanted to do with him. And he said, "Why don't you go to Pfizer? I mean, I know you were a production manager for many years. Go to Pfizer. If they will accept to analyze your raw materials and your finished product, and they give you a letter to that effect, bring it. We'll come and inspect the place. And then if we find it good enough to make simple ointment, we will approve it." That was the first destiny helper. Now, I knew that I needed to have a couple of machines to, especially the one to fill the ointment into aluminum collapsible tubes. Then God also sent another destiny helper. How? This was a man who was representing the big manufacturers of pharmaceutical equipment in Europe at the time. He had a company called Itwa Pack. His name is Mr. Augustus Itwa. And we had known each other when I was at Pfizer. And then when I also moved over to doing, we were always, because he was representing the major equipment manufacturers of pharmaceutical equipment in Europe. So I went to him in the office. I had a small brochure in my hand of a tabletop kind of, tube crimping machine. And he looked at it and he said, "I know you don't have the money to buy this." So he just went in, to his library and brought a catalog. He said, "This machine is manufactured in Germany. It doesn't use electricity. I'm going to buy it with my money." That's what he told me. At that time, that small piece of equipment that doesn't use electricity, but you will use the hand like you are sewing a dress, cost 6,000 Dutch marks at that time. And he bought it and he said, "As soon as you start, you can be paying back little by little." That was another destiny helper.
I met a colleague decades back, first when he was working with Glaxo Pharmaceuticals in Apapa. Then he moved to Pfizer, and then he set up his own business. So
decades. It can be less than 40 years. Kunle has always been a very cool-headed, honest fellow. And over the years, on very many occasions, I had a base in Germany. He always came either to visit some of our principals, those companies we represent here. He produces first-class quality products. So as long as he continues doing that, he will continue to expand.
So this is how God actually, arranged some people along the way for me. And I remember in 1995, when we decided to participate in the first PSN conference, the annual PSN conference. It was in Port Harcourt. I think it was Presidential Hotel. I remember, I put the products in, I had a small car, Toyota Tercel, and I drove from Lagos to Port Harcourt via Warri and had a stand at the PSN conference in 1995. And of course, challenges here and there, but we kept the faith, and God, has been faithful, and then the growth also has been steady.
Okay. My name is Ako Emilia, a staff of Drugfield Pharmaceutical Company. I've been with Drugfield Pharmaceutical Company for 30 years now, between that 1993 and 1998. Compared with now, with the aid of modern technology and good managerial skill, there is a lot of big transformation has taken place. Then we started with 5 products, but as I speak now, Drugfield has introduced many products in the market, like liquid products, dry products, sterile products, and injectables.
So by the time NAFDAC came and said, or the regulator, it wasn't called NAFDAC at the time, said I needed to move. I already bought 6 plots. And for the first time I came here, and then we started to construct, in a gradual manner. And our growth, continued, here. And we started adding other dosage forms, like tablets, capsules. Now, today we have several dosage forms, gels, creams, apart from ointments. We also have tablets, capsules, powders. We have sterile products, injectables, eye drops, and liquid preparations, so it's been phenomenal, actually. Yeah.
When we look at his company, Drugfield, the foundations of Drugfield was basically the man running it today and founder, who had a detailed, quiet analysis of the state of the Nigerian pharmaceutical market. He was able to identify opportunities where others saw challenges. He saw the cup half filled rather than being half empty. He saw a niche, which was on creams, on topical preparations. He explored that particular niche. He became a guru in it, and indeed he became a leader in production of topical preparations. Not only did he have an understanding of the gaps, he also had an understanding of the steps that needed to be taken to fill the gaps. So he took action, and he put everything into it. And this when you visit him, and you see how he relates to his people, and you will know that the passion to produce has always been there, right from his days when he was working for other people.
We kept on building capacity, actually, based on the products, based on volume. And the way things, were going at the time, we thought, yeah, that growth was going to be phenomenon, that we'll run out of capacity and all that. But not, not remembering that Nigeria was like a dumping ground. Immediately, the multinationals started to leave. People were bringing finished products from, all corners of the world, from China, from India, from Vietnam, from Bangladesh, Pakistan, name it. And they became serious. That became a very, very serious challenge to us. That's why a country like Nigeria is only able to produce about 30%, out of the 100%. The remaining 70 is coming from foreign, countries. And even though the country, talks about a plan, to reverse that order, but it has not really been fulfilling. So in terms of capacity, we are very, very much stable on the ground. We have quite a lot of excess capacities, to be able to react to, favorable policies of government that may come at any time, but we are still waiting.
I think that Drugfield is a company of the future. I have in mind that if our politicians and our leaders have an idea of what is going on here, if they have an idea of what human capital development this company is able to nurture, they will be excited. Maybe this 30th anniversary will be a shout out to our compatriots. I'll call them compatriots. They will come and see us and see what they can do to improve the quality of healthcare in this country. And if they partner with Drugfield, they will be surprised at how far we can go.
Drugfield commitment to quality is embedded in its business culture. From material sourcing to manufacturing and beyond, they hold true to high quality standards. It's more than a practice, it's a culture that has earned us market acceptance.
My name is Ekundayo. I'm the Deputy Managing Director of Drugfield Pharmaceuticals Limited. I started working for the company a few years ago, probably about 7 to 8 years, and it's been a blessing to be part of the company. So yes, in my position, we work together, I report to him. One thing that I appreciate about him is that he demands excellence from whoever he's working with. He also challenges you, regardless of whether I'm his son or I'm a relative. He has the same energy when it comes to work. As an employer, he challenges you. I remember when I first arrived then, he asked me to do a write-up on something. So of course I went back, I thought about it, I think I typed it up, I was feeling good. So I submitted it to him. He just kind of, his response, man, I looked at this is something that I spent time doing, but his response was, I guess he had looked at it and saw that some things were not right. So it forced me to actually go back and look at what I did. And of course, doing that, I saw that, okay, I could do things better. And, and working with him, you can't just go to him anyhow. You have to make sure that you know what you're talking about. You have to know what you're doing. You can't just come and just come anyhow, So he demands excellence and he challenges you in your position. So that's one thing that so he's been a great employer. It's been great working together with him.
There's a personality that I would like to talk about, who is also another destiny helper. This is a man that I met very briefly at Pfizer. He was actually, he had left Pfizer International at the time. He was the one, he worked for Pfizer International. He was the one building factories around the world, in South Africa, in some countries of Asia, and then the Pfizer manufacturing plant in Oregon. He was the one who built it. He also built some livestock feed plants in Aba Nigeria. So he had left Pfizer shortly before I joined, but we met. I remember on a particular occasion, I think it was in 1996, Pfizer was closing a plant in Germany, and he saw a tube filler, and he asked me, would you like this? Because Pfizer is closing the plant and it's going to be available. And I said, yes. And he said, okay, I'll buy it with my money. I'll send it to you. You can pay me later. And since that time, he has been involved with us, technically offering a lot of advice, a lot of service, and giving us what you cannot imagine. If you want something like this, you need to go to this man in Austria, Mr. Plotzeneder, Ferdinand Plotzeneder. He became another destiny helper for me.
My name is Ferdinand Plotzeneder. I'm from Austria. I'm a mechanical engineer. I worked in Nigeria from 73 to 77. My job at that time was to build the Pfizer Nigeria factory, which later on became, was sold to Nimitz, yeah. But at that time it was my job to do that. And I had, it was for me a great opportunity to get to know this country. Yeah. Well, Mr. Ekundayo is a very exceptional man. First of all, he is a fantastic pharmacist. And as a young man, he was also production manager at Pfizer Nigeria, which further enhanced his quality as his professional knowledge. He has a wide and deep knowledge of the pharmaceutical products needed in Nigeria, and because with that background, he eventually decided to start his own business, which is now 30 years ago. He had the vision to do something for himself and for the country. He had the knowledge. He recognized the potential of Nigeria being one of the most important economies in Africa, and he saw this is the right thing for me to do. That's the way I see it.
Drugfield's materials are sourced from recognized and accredited suppliers, ensuring the right quality active ingredients. They subject raw and packaging materials to rigorous tests, complying with Pharmacopoeia CGMP standards. Regular facility upgrades align with modern trends and regulatory demands. The strength of Drugfield lies in its collective spirit. Passionate, result-oriented, and ethically committed, we operate under the guidance of constantly reviewed quality management system, meeting industry requirements and customer satisfaction. Drugfield goes beyond business, actively participating in the upliftment of lives. Financial and material donations, road maintenance, educational scholarships, and partnerships with organizations demonstrate our commitment to societal well-being.
It's no longer playing within the 220 million population in Nigeria, but it's playing within the segment of 420 million people in West Africa, as well as the over 1.3 billion people in the African region. I see him being a leading player within his niche market area, and that should be a great pride, not just to Drugfield, but to Nigeria.
One thing is, Drugfield has a wide range of products, covering almost all the needs of standard products needed in this country. Drugfield has the vision of making affordable products for the people, and Drugfield also has the ability to make difficult products. As far as I know, Drugfield is the only company in Nigeria making sterile injectables. That's a sophisticated product, all the others import. Drugfield makes it here. This is something fantastic. So there's one factor which puts Drugfield ahead of others, I think.
I remember a few years ago when we had the opportunity to produce a world commodity, I would say, chlorhexidine gel for umbilical cord care in the newborn. We were the first to manufacture that product in Africa and the second in the world. That actually brought Drugfield to world stage, you know, because we're holding meetings with stakeholders, WHO, UNICEF, big, companies, and we're having monthly meetings. There was a World Chlorhexidine Working Group, and we were exporting these products, and we are still exporting to other countries. I think it's very fulfilling. So the vision of Drugfield is like the vision of Pfizer. Not only to be in one spot in Nigeria, to build more plants even in Nigeria, and build plants in other countries around the world, especially in Africa. This is the big vision.
Because I think that the human development that Drugfield is nurturing in this company can actually be a kind of catalyst that will nurture other companies. I think we should begin to show more respect for doctors, engineers, lawyers, and professionals that can add value to the quality of life of our people. And then when our young people are being talked to, they should identify people that have long-standing impact on the society.
I am very confident that the future of the company will be great, that even when I am no more, the company will continue to exist in good health. And I am very, very hopeful. And at 70, you ask me, when are you going to retire? I'll tell you very, very soon. I'm working on it. And when I retire, retirement is retirement. Before I now completely, fizzle out. So this is my plan, and God has been faithful.